Have you ever heard that the secret to a healthy life lies in taking care of your heart or brain? But what if I told you that the true key lies in your kidneys? Yes, exactly, those two small organs that you barely remember exist could be the fine line between a full life and a routine full of limitations. But here's what no one tells you: what you think you know about kidney health could be completely wrong. While most people follow outdated and confusing advice that often does more harm than good, few understand the real impact that simple choices can have on preserving kidney function. And here's the surprise: there are natural substances and strategies that could revolutionize the way you care for your kidneys, but they have been ignored or even banned for reasons that, at the very least, seem questionable. Imagine avoiding a life of dialysis and transplants with simple changes that almost no one is willing to share with you. Sounds too good to be true, doesn't it? Well, keep reading, because what you're about to discover might be the turning point your health needs. We are about to dive into a world of powerful and controversial information that could completely change the way you see kidney health. Startling facts. Have you ever stopped to think about the importance of your kidneys to your health? It's astonishing how something so essential goes unnoticed in our daily lives. The truth is that 1 in 3 American adults is at risk of developing kidney disease, but few realize it. This fact alone should set off an alarm, as kidneys are fundamental to our body's balance. They are responsible for filtering toxins, regulating blood pressure, and even producing vital hormones. Ignoring kidney health is like neglecting a car's engine. You don't see the problem until it causes major damage. To better understand the scope of this problem, think about your last visits to the doctor. How many times were you advised to take care of your kidneys? Probably few or none. This is because kidney health rarely receives the attention it deserves. When we talk about health, we immediately think of the heart, lungs, or even diet. However, what few people know is that the kidneys play a silent but crucial role in the proper functioning of the body. And with the growing prevalence of diseases like diabetes and hypertension, the chances of compromising kidney function increase significantly. The most concerning part is that most people do not show symptoms until the disease is in an advanced stage. It's like living in a house with hidden leaks that eventually cause a collapse. Initial signs like constant fatigue, swelling, and changes in urine can easily be confused with other less severe conditions. That's why regular checkups are essential to monitor kidney health, especially if you have a family history or other risk conditions like diabetes. Ignoring these signs can have serious consequences, and no one wants to deal with the devastating impact of kidney failure. And if you're still not convinced about the importance of taking care of your kidneys, consider the impact that kidney disease can have on your quality of life. Dependence on dialysis, severe dietary restrictions, and the need for transplants are just some of the realities many face. It is vital to understand that prevention is always better than cure. Maintaining a balanced diet rich in vegetables and low in sodium, controlling weight, and avoiding excessive medication are simple but effective steps to protect your kidneys. And speaking of protection, could some natural substances like barberry be the key to improving kidney function? Barberry's controversy. Barberry, a plant known for its medicinal properties, is the subject of controversy in some parts of the United States. Despite its potential benefits for kidney health, it is banned in several states due to environmental concerns. This ban raises many questions, especially when we consider that scientific studies point to the positive effects of barberry in reducing blood glucose levels and improving kidney function. And let's be honest, in a world where so many harmful substances are allowed, why would something with so much potential be restricted? For those living with diabetes or prone to developing kidney problems, barberry could be a true ally. The plant is rich in berberine, a compound that has already shown, in various studies, its ability to regulate glucose levels and consequently relieve pressure on the kidneys. This is particularly relevant, considering that diabetes is one of the leading causes of chronic kidney failure. Imagine if you could incorporate this plant into your diet, helping to keep not only blood sugar levels in check but also promoting kidney health. But the ban in certain states complicates access to this. Despite the controversies, it's important to remember that science continues to explore the possibilities that barberry offers. In some countries, such as Iran, where the plant is widely used, studies have shown that it can be an effective tool in preventing kidney complications in diabetics. Wouldn't it be interesting to see how barberry could be used in treatment protocols in the United States, if not for the current restrictions? It's a shame that environmental concerns are preventing the advancement of a potential natural treatment for millions of people who could benefit. However, it's worth reflecting on the balance we need to find between protecting the environment and exploring the benefits of plants like barberry. Conservation is crucial, no doubt, but isn't there a way to reconcile environmental interests with the health needs of the population? Who knows, with more research and a careful approach, we may find sustainable ways to harness the benefits of barberry without causing harm to the ecosystem. And speaking of natural substances facing restrictions, did you know that turmeric is also at the center of a controversial debate? Turmeric ban debate. Turmeric, a spice widely used in cooking and traditional medicine, has been recognized for its value for centuries. However, the FDA has proposed a ban on curcumin, the active compound in turmeric, sparking a heated debate. This proposal is surprising, considering the numerous studies that highlight the anti-inflammatory and kidney protective properties that curcumin offers. It seems contradictory, doesn't it? A substance that could help protect kidney health is being threatened with a ban, while so many other products with questionable benefits continue to be freely marketed. For those struggling with chronic kidney disease, CKD, curcumin can be a true ally. Research suggests that it not only reduces inflammation, a key factor in the progression of kidney disease, but also can improve creatinine levels and glomerular filtration rate, GFR. In other words, regular use of turmeric in the diet could help keep the kidneys functioning more effectively. So why would the FDA be inclined to ban something that seems so promising? Perhaps the answer lies in the outdated and confusing guidelines that govern CKD treatment, often ignoring new scientific evidence in favor of old regulations. The most frustrating part is realizing how these guidelines directly affect the lives of millions of people. Imagine being a CKD patient and discovering that a natural compound that could improve your condition is being taken off the shelves, while other treatments, often more expensive and less effective, continue to be recommended. This puts patients in a difficult position, where they need to rely on often conflicting information. The reality is that for many, turmeric is already part of the daily routine, whether in teas, spices, or supplements. What will it take for the medical community and regulatory authorities to recognize the therapeutic value of this compound? This situation makes us reflect on the urgent need to revisit and update CKD treatment guidelines, taking into account new findings and the experience of those living with the disease. After all, science is constantly evolving, and what is considered safe or effective today may change tomorrow. And if curcumin is a victim of this lack of update, how many other promising treatments could be being neglected? For example, vitamin E, another supplement that could benefit kidney patients, also faces resistance, even with evidence of its efficacy. Vitamin E's importance. Vitamin E is one of those nutrients that everyone has heard of, but few truly understand its importance, especially when it comes to kidney health. Interestingly, despite not being widely banned, vitamin E is often discouraged in treatments for chronic kidney disease, CKD, particularly in diabetic patients. This is intriguing, as numerous studies indicate that this antioxidant can improve the glomerular filtration rate, GFR, and creatinine levels, crucial parameters for kidney function. Who would have thought that something so accessible and simple could have such a positive impact on kidney health? For patients dealing with CKD and diabetes, vitamin E can be a powerful ally. It works by combating oxidative stress, one of the main factors contributing to the progression of kidney disease. Imagine incorporating vitamin E-rich foods, such as almonds, sunflower seeds, and spinach, into your daily diet. Not only are these foods delicious, but they can also offer extra protection to the kidneys, helping to keep kidney functions normal for longer. However, with so much skepticism around supplements, many people end up neglecting this potentially valuable support. What makes this situation even more paradoxical is that while vitamin E supplements face resistance, other less beneficial products continue to be widely promoted. The question is, are we really putting the needs of patients first? Perhaps it's time to reconsider and take a closer look at studies that show the benefits of vitamin E, especially for those who are most vulnerable. Incorporating this vitamin into the routine, with medical guidance, of course, can be an effective and natural way to care for the kidneys. This discussion makes us reflect on how health guidelines often seem disconnected from the realities experienced by patients. Instead of simply following old rules, perhaps we should focus more on recent evidence and the results that really matter to those on the front lines of these conditions. If vitamin E can offer real benefits, why not give it the recognition and attention it deserves? And speaking of controversial supplements, the ban on others like bitter melon due to phosphorus content is another example of how guidelines can be misaligned with reality. Questionable prohibitions. The ban on certain supplements, like bitter melon, due to phosphorus content is a classic example of how health guidelines can be outdated and out of touch with reality. What many don't know is that while these supplements are discouraged because of phosphorus, the actual content of this substance in them is negligible compared to the processed foods we consume daily. It almost seems ironic, doesn't it? We are avoiding natural supplements while ingesting large amounts of phosphorus in processed foods without even realizing it. To better understand this situation, think about how many processed products you find on supermarket shelves. These foods, often rich in additives and preservatives, are much more significant sources of phosphorus than any natural supplement. However, it is bitter melon and other similar supplements that end up being banned. This raises an important question: are we really basing our health decisions on solid evidence, or are we following recommendations that urgently need updating? For those seeking natural and less aggressive alternatives for the body, these prohibitions seem unfair and arbitrary. The truth is that by avoiding these supplements, many miss out on the opportunity to explore the benefits they can offer. Bitter melon, for example, is known for its anti-diabetic properties and can help regulate glucose levels, something vital for kidney health, especially in diabetics. But with the ban in place, many do not have access to these advantages. It's as if we are putting patients at a crossroads, where they have to choose between following outdated guidelines or seeking alternatives that are not officially recommended but may bring real benefits. This situation leads us to a larger reflection on how health guidelines are formulated and updated. Instead of continuing to ban supplements based on outdated information, shouldn't we be reevaluating these recommendations based on current research and concrete evidence? The fact that processed foods, which truly contribute to high phosphorus intake, continue to be consumed without restrictions is a clear indication that something needs to change. After all, when the goal is to preserve kidney health and overall health, shouldn't we be more open to exploring all available options? Now that you are armed with all this knowledge about how to protect your kidneys and avoid serious diseases, the big question is, what will you do with it? It's not enough just to know, you need to act. How can you apply this information to your daily routine to ensure your kidneys continue to function as they should? Think about the changes you can make today, whether adjusting your diet, seeking natural alternatives, or even questioning the guidelines you have followed so far. But before moving forward, I want to ask you a provocative question. Are you willing to leave old habits behind and invest in your kidney health in a conscious and informed way? Because if the answer is yes, then you are on the right path to avoiding serious complications and ensuring a healthier life. And remember, you are not alone on this journey. If this content was useful to you, don't forget to subscribe to the channel and activate notifications to continue learning more about how to take care of your health in an integrated way. This is just the beginning, and there is much more to discover. Let's walk this path together.